We are Sanford Health, the largest not-for-profit healthcare system in the U.S. Strong research division, growing health plan. It's a unique, dynamic, growing organization with a lot of momentum. We have to take the complexity of a high technology, high test organization and make it personable and approachable. We're a humble hero brand, very rooted in the spirit of the Dakotas and the culture of the Dakotas.
The biggest explosion occurred with some of the changes in the federal legislative activities over the last number of years that provided for essentially the digitization of healthcare. And what that's done is allowed us the ability to provide more information across different health systems, but also with the patients themselves.
This idea that no matter where I go in the system, I've got this core central piece of information that tells everything about me. We live in an environment where we have more high-speed internet connections to our patients' homes than in any other environment in the United States.
The real explosion is in people having their own mobile devices or their own mobile access, and us having to deal with the diversity of that.
How do we communicate in real time to a board of trustees that's all over the nation, not just over our 130,000 square miles? No matter where a board member's at around the world, through their iPad, they can access that information.
It's a tremendous demand on the types of resources that we have to have available and the types of technology and the infrastructures that we need to have in place to meet that demand. Cloud computing has been very vital to us to be able to take a certain type of service or application and launch it relatively quickly and be able to provide support in a very short instance compared to what it would be if we were using some of our own internal infrastructure and resources. And I see that growing. With the cloud strategies that you deploy, you need to make sure that you've got a good partner. You've got to have people that have similar cultural fits, they've got to have the capacity and the technology resources to meet your demand.
Again, the ability to collaborate in real time in healthcare between physicians, between caregivers, between locations, everything from their images from a radiation MRI to their discharge from the ER to their ambulatory visit in the clinic has got to be available in real time.
This is 7 by 24 by 365, and we cannot have failure in the types of services that we provide because it's critical to patient care.
The next level is about how patients can interact with physicians and other care providers through different mechanisms, through mobile apps, through e-visits.
It's a lot of the younger culture that is driving the change with social. Because when they're in those situations, they need people there on the other end to listen to what they're saying.
It's not just being in the conversations, it's monitoring and listening. So tools like Radiant 6 that allow us to really look at what's happening, what's the nature of that discussion, both from the traditional kind of PR, positive, negative concept to really what are the themes and threads that we need to tie into here, and how are we influencing those conversations.
Just seeing how that interaction works and how they communicate or don't communicate in some instances has been very vital to understand how that would apply to the changes that we need to put in place to meet the demands of healthcare.
It doesn't replace traditional media. It's another channel that helps support and align as traditional media changes. You're not waiting 4, 5, 6 months to know what's happening with a campaign. You know at the end of the first day. It is a tremendously exciting time from a marketing perspective.
You have to get in the game, you have to try some things, you have to learn from them, and then advance and move forward. Change your strategy constantly, because if you don't, someone else out there will, and someone else out there will provide the services that our consumers are demanding of all of us.